We're going to run a couple of moments over time, but summary statements.
Government functions simply cannot replace human functions in the end. The principles of healthcare matter. Do you believe in tyranny where one person, through the government or otherwise, has the right to impose their will on you? Is that the kind of system you want? It's more important than healthcare. The disease, if there is one in our system, is special interest government intervention, which is creating all of these problems. Other places where the markets are allowed to work, you have much more efficient delivery of services. The Obama plan does nothing to address the systemic problems, all of which go back to government intervention in the first place. So our biggest problem today is not markets, it's the fact that we're already a socialist system in many respects. We're a huge social welfare state already. And we're just trying to prevent a train wreck by finding ways other than just facing the fact that we have to be accountable and responsible and make real adult choices for a change. Competition is the way that we can naturally heal many of the symptoms that we've identified. And I can't leave a conversation of healthcare without talking just for a second about privacy. I don't want the government to own me. I don't want them to own my healthcare. I don't want them to own my decisions. I don't want them to have a urinalysis of me every time I turn around. I don't want them to do a blood test on me or a DNA test on me. Is this the kind of a system we want? Where the government owns all of this information about us? Liberty is the answer. It's a holistic prescription that relies on a natural healing process where human beings interact. That's what the market is. It's interaction. And you know, where we are now is so far down the road towards a social welfare state that we need to just turn first, and we need to develop a rational transition plan back to a space where individuals are able and capable and responsible for their own health care. We need a healthy transition. We're not going to throw the elderly out. We're not going to do any of those things that people say when they point to the right or they point to a libertarian who believes in market values. Principles matter.